Joining me now is the pulmonary and critical care specialist at Northwestern Memorial Hospital in Chicago, Dr. Michelle Prickett. Dr. Prickett has been working the ICU and is known to bring an aura of calm to an overwhelming situation. And Dr. Prickett, you don't hear from doctors and nurses and medical workers, particularly critical care people, about being overwhelmed. You signed up for that the day you decided to become a doctor. But we are hearing on a daily basis from people who say their own care, the care of their families, just the emotional stress that they're going through is something that they have never experienced in their careers before.
Thank you, Ali. I think that's exactly right. We're built for this. We thrive in situations where there's mass chaos. We like to bring calm and try to control these situations, and we do a very good job of it. The issue we have right now is just volume. Patients have been coming at very high rates. Our numbers from October to the end of October to the end of November have essentially quadrupled. So the patients that are coming in, we know how to take care of them. It's just a matter of volume.
The first COVID patients that came into Northwestern Memorial Hospital's intensive care with COVID were, in fact, your patients. Often it'll be a pulmonologist who works in emergency or critical care who sees these patients. But before COVID, your rule, your personal mantra that you followed is that nobody dies alone. That was a sort of a good feeling for you and something that was entirely manageable before COVID. This is a real problem now where people don't have their families around them and they know they're dying and their families know they're dying.
I mean, I think we're all human. So we're doctors, we're nurses, we're respiratory therapists, we're healthcare workers. We're all human, and we know how it feels to be alone, and we know how scary this disease is. We also know the look in people's eyes when they can't breathe. And so as a pulmonary doctor, that is a look that I have seen way too many times in my career, and I wish I never were to see, but unfortunately that's what we're seeing. And so you see that fear, you see the concern, and you're human. And so we are trying to provide that empathy. And it's, even though we're professionals, we're still human, and it's emotionally draining. And we still need to come home and be with our families as well and support their needs emotionally as well as physically. And so it's just been a lot.
What happens in hospital settings? Because there are a lot of us who deeply appreciate what doctors and nurses do, but we get the sense that you are built to be a little bit detached from it because otherwise it would break you to deal with all the people you have to deal with. And now people come into these hospitals and you are replacing their families.
It's true. The COVID ICU is one of the quietest ICUs because all the doors are closed. There's no family. There's no conversations. The vast majority of our patients are ventilated, so not speaking with us. So it's a very quiet time, except when there's emergencies. So there's a lot of time to reflect and understand how important it is for us to provide that emotional support to our patients, because it's very obvious that there's no families there. We thrive on being able to communicate with our families and let them know. We're doing it now by telephone and Zoom and other methods that is relatively foreign to us, and historically, unfortunately, it's very common to us now within the last 9 months.
What a time, Dr. Prickett. Thank you for what you do. Please send our regards and our thanks to your colleagues at Northwestern Memorial Hospital for all that you are doing for us. Michelle Prickett is a pulmonary and critical care specialist at the Northwestern Memorial Hospital.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.